This is River Navarro from Bakersfield Behavioral Healthcare Hospital. I'm the Director of Clinical Services here, and I'd like to say hi and happy Wellness Wednesday to all. I'm going to kind of follow up with all of you about a previous topic. So this is going to be part 2 in talking about, this is going to be coping skills to reduce non-suicidal self-harm behaviors. So I did part 1, a couple weeks ago or so, and kind of introduced the topic itself, just kind of what the behaviors were, and things like that. So now we're going to get into coping skills. And this could be for someone who is struggling to resist urges to self-harm. This can, some of these tips can be used for maybe a family member, friend, if you have a loved one or someone you care about is engaging in self-harm behaviors. These are, activities, skills, tips, things that, might give you some insight of things that you might be able to try with that person to either distract them or to keep them busy, or just to kind of learn a little bit more how you may be able to help them in some way. So I'm just going to jump right in. First things first, I want to kind of go over 3 main points. This would be specifically for someone who is having urges to self-harm or has self-harmed before. So first things first, you have to be able to recognize your triggers, right? So triggers are, many times people will say that they feel triggered when they have an urge to self-harm. So different things that might trigger someone could be, it could be people, situations, sensations, emotions, even anniversaries of events. There's a lot of different, triggers that someone could experience. So it's really important for someone who is struggling. There has to be kind of part of awareness, for them to start to recognize what types of things are triggering them to have urges for those behaviors. Also, it's also important to be able to identify maybe physical changes, emotional changes. So I'll give you kind of some examples. So noticing if, your heart tends to beat really fast, there's an increase in your heart rate, intense emotions trigger you, feeling disconnected, maybe like you're outside of yourself or you're not experiencing things within yourself. So feeling disconnected from yourself can be a big trigger for a lot of people, or feeling not really one with yourself. Intrusive thoughts about self-harm, and also engaging in unhealthy decisions, like not taking care of yourself, not sleeping well, not eating well, engaging in destructive behaviors, that can be, alcohol or drug abuse, or just being around, negative influences, risky behaviors. It could really be anything. But it's really important to start making connections between kind of, like what changes within yourself when you're feeling triggered and you're having these urges, so that you can start practicing some coping skills and intervening before it results in self-harm. Another tip is to try journaling or even keeping a diary. So a lot of people will say that, kind of documenting what they're feeling, what they're thinking, that can help them start to make connections with their triggers or when they're experiencing intrusive thoughts or urges to self-harm. So I'm going to kind of switch gears here and talk about some what we call distraction skills. So distraction skills are really important when you're struggling with something and you're just trying to get through a moment. So distracting yourself can be a coping skill. And so it's really important to remember that. All of the different distraction skills that I mentioned, these can be practiced individually. They can also be behaviors or activities that you do with other people. If you're a family member, friend, loved one of someone who self-harms, this is good to know. Some of these things you may be able to do with this person or to be able to help distract them when they're struggling. So I'm just going to kind of go through a list here of different distraction skills that I liked, and hopefully they'll help. First one is exercise, right? So exercise has a positive effect on people just in general, right? It's good for your mood. It's good for your health. When you're exercising, you can practice mindfulness. I know I've talked about mindfulness. I probably bring up mindfulness in every video, but there's a lot of benefits to exercise, of course, and exercise can also be used as a form of distraction. Spending time with a pet or animal. I know that is soothing for a lot of people, and also having to focus on caring for or petting or cuddling or just kind of spending quality time with an animal can be therapeutic for a lot of people. Wrap yourself up in a blanket. So I really like this skill. I am notorious for wrapping myself in a blanket around my house. I think anyone in my family would probably say that. A lot of people like the idea of being wrapped up in a blanket because it's very soothing. Especially if the fabric is really soft, especially if you've just done laundry and your blanket smells wonderful. There's just a lot of kind of added benefits. Just being comfy and cozy is soothing to a lot of people. Going out in nature, hiking, walking, a lot of people find nature therapeutic as well. So for those of you who have a family member who's struggling, get them out in nature. It might help. Crying. Crying is an excellent coping skill, distraction skill, but really crying is very important because a lot of people tend to hold in their emotions, and sometimes that release of emotion is enough to get them through a moment. So it's perfectly okay to cry. Feel free to cry with your loved one. You might feel better. Try taking a nap. So I know sometimes when I'm grouchy or I'm having a bad day or I'm feeling overwhelmed, a nap really comes in handy, even if it's a power nap. And I set my alarm for 15-20 minutes, just kind of hitting the reset button, right? And naps are really good for that. If you're experiencing an emotion that's very intrusive and very intense and powerful, sometimes taking a nap and hitting a reset button, does help. Listening to music. A lot of people, a lot of our patients tell us that that's probably one of the top 3 coping skills that we hear here is listening to music is very helpful. Talk to a support person. It's always good to have support in your life, especially when you're struggling. You don't have to hold on to everything yourself. You can rely on others for support. Try some deep breathing. So I know I've talked about deep breathing at some point as well, but for a lot of people, focusing on their breath and, inhaling and exhaling, and, they can pair counting with breathing. You can pair so many other skills with deep breathing, and that also has a calming effect on people. Try cleaning or organizing your home. So I know I did like a decluttering video, I think Declutter Your Life, several weeks ago, but even just focusing on one space or one area or one closet, one drawer, just something, focusing your attention on that and being mindful can also help distract from something intense. Try holding some ice cubes. So I know a lot of our patients really like this one because of the physical sensation, and it's very intense and it also helps kind of reset and distract. Try engaging your senses. So I'm pretty sure I did a video about that as well at some point, where I'm sure I was talking about grounding and using your senses to self-soothe. And I know I talk about self-soothing all the time as well, but we can use all of our 5 senses to self-soothe, to distract, and to comfort ourselves. Taking a cold shower, that's kind of similar to holding the ice cubes, right? So we're tapping into physical sensation and engaging your senses and having a sensory experience that helps distract from what you're feeling. Try writing a letter. And this one you can get pretty creative with. You know, a lot of people don't really write letters anymore to people, but you can write a letter to yourself. You can write a letter to another person. You can write a letter to the part of you that is struggling and how you would want someone to comfort you. You can write a letter to a previous self or you kind of in the past, and kind of soothing you in an earlier stage or in your current stage. There's just so many different ways that you could get creative with that one, but writing for a lot of people is therapeutic. Planting or gardening. So this one's probably in my top 5. There's something about being outside and having your hands in some dirt for a while and planting something and caring for it and watching it grow. There's something really powerful about that. And gardening is also a good way for you to be outside, to get some sunshine, and to be outside of your house. And there's just so many benefits to being outside and planting or gardening. You can relax your muscles. This one's really important. There's all sorts of progressive muscle relaxation exercises and things online, and you know there's a different kind of guided meditations and exercises through that. But even tightening your muscles and releasing them can also be helpful. I know I get a lot of tension like in my face and my shoulders, and you know sometimes stretching or sometimes kind of clenching and unclenching, you know, different parts of your body can also be useful in kind of getting rid of that tension that you're experiencing. And the last tip and distraction skill is try expressing yourself with art. Whether that's painting, that could be writing poetry, that can be any artistic talent you have. You know, I have people in my family who are extremely talented, that they use a variety of, you know, mixed media formats and so on and so forth. And, you know, I think they would probably tell you it's therapeutic for them. Art can also be very useful. And, you know, if you're a family member or a loved one of someone struggling, you know, do some art projects with them, get crafty. You can get creative. So I think it's really important to engage in some of these activities with your special person and see if you can be of support to them. So that is all I have for today. I hope you found this information useful. I look forward to coming up with another topic for next time. Have a great day, everyone. Bye.